I would like for you to take a moment, close your eyes, and visualize something with me. Pretend that you're at the doctor's office. They just diagnosed you with this life-threatening disease called cancer. You're probably really scared. But no worries, the doctor says there's this treatment that can help you called chemotherapy. What is chemotherapy? How does it work? Is it really successful? Am I going to have side effects? You probably have so many questions and you're really confused. There's many different types of cancer. There's breast cancer, colon cancer, liver cancer, and many other kinds. According to CNN.com, cancer is the second leading cause of death in America. Chemotherapy is the most common way to treat cancer. This is a picture of my mom and dad. Both of my parents underwent chemotherapy before I was the age 15. My dad was diagnosed with cancer when I was just a baby, and he went through chemotherapy, and it allowed him to live for 10 more years before he died with his second battle of cancer. My mom suffered with breast cancer when I was a freshman in high school, and chemotherapy saved her life. She's now 7 years free of cancer today. What is chemo? Chemotherapy are drugs that are put into the bloodstream to kill cancerous cells. It can be administered through an IV, orally, or injected. According to the book Cancer Chemo Care Plans, it damages both healthy and cancerous cells. This can cause side effects such as nausea or sometimes even more serious damage. Now you know what chemotherapy is, but how do these drugs work? According to the book by Thomas File, New Insights in Treatment of Severe Infections, different doses are used for the severity of your cancer, and the doctors also take in the condition of your immune system. Before you undergo chemotherapy treatments, you do blood tests and you check your white blood cell count, and if your immune system is not up to par, you don't undergo treatments that day. We already said chemotherapy is administered through the bloodstream. Unlike radiation, chemotherapy can treat a widespread area, whereas radiation only focuses on one area of the body. Now you know what chemotherapy is and how it works. But is it really successful? We look at the story of Jason Zimmerman. He battled 3 bouts of cancer. According to CNN.com, survivors of the last 20 years have better outcomes with chemotherapy because of the advancements. And that's just like Jason Zimmerman, the 3 battles of cancer, chemo saved his life all 3 times. So I'd like for you to picture the doctor's office again. Now you know what chemotherapy is, how it works, and if it's successful. The doctor asks you, are you going to undergo chemotherapy treatments? What do you choose?